Decent work is a central tenet of human resources for health management. In this video, we will explain what decent work is, why it matters, and essential actions to ensure decent work. Let's examine the landscape. The health sector faces ongoing challenges: dissatisfaction with working conditions, heavy workloads, long working hours, low salary and unequal pay for women, insufficient resourcing, weak career prospects and limited access to training and lifelong learning, increasing violence and harassment in the workplace, occupational safety and health risks, including their biological, chemical, physical, ergonomic, psychosocial hazards, insecure employment contracts. The COVID-19 pandemic, like other emergencies, generated strong appreciation for health and care workers. It also underscored that health and care workers often are faced with challenging conditions that impact their health and well-being. Violence and attacks, stigma and discrimination, overwork and understaffing, compassion fatigue, which can lead to stress, burnout, and other mental health conditions. How do we address these challenges and ensure a competent, motivated, and supported health workforce that delivers quality, accessible, and affordable patient-centered care, reaches people in every community with primary healthcare services, and supports countries to strengthen health systems, progress towards universal health coverage, and achieve the Sustainable Development Goals? According to the International Labour Organization, decent work is understood as productive work for women and men in conditions of freedom, equity, security, and human dignity. Decent work delivers a fair income, provides security in the workplace and social protection for workers and their families, offers prospects for personal development, and encourages social integration. Decent work gives people the freedom to express their concerns, to organize and to participate in decisions that affect their lives. It guarantees equal opportunities and equal treatment for all. We asked and you responded. Decent work for health and care workers is our duty of care. There is a direct relationship between decent work for health and care workers and the quality of care delivered to patients. Health worker safety is a priority for patient safety. Patient outcomes, such as morbidity and mortality, are closely associated with staffing levels, staffing stability, and health workers' education levels. For health workers, illness can prevent work entirely, cause job loss, and prevent gains in earning. Decent work is crucial to recruiting, motivating, and keeping health workers in service.
No country, hospital, or clinic can keep its patients safe unless it keeps its health workers safe. Now, more than ever, we have a duty to give health workers the safe working conditions, the training, the pay, and the respect they deserve. Join us in speaking up for health worker safety.
Recent landmark decisions have reaffirmed the obligations of governments and employers to protect the health and care workforce, ensure their rights, and provide them with decent work in a safe and enabling practice environment. In June 2022, the International Labour Conference amended the ILO Declaration on Fundamental Principles and Rights at Work to include a safe and healthy working environment. The 75th World Health Assembly approved the Global Health and Care Workers Compact, which reflects a compilation of international laws, norms, and treaties, and encompasses 4 domains to ensure decent work: preventing harm, ensuring inclusivity, providing support, and safeguarding rights. Preventing harm from occupational hazards, workplace stress, violence, and harassment is essential to preserve the health and care workforce, especially women and young health workers. Ensuring inclusivity increases equity. A diverse health and care workforce can be more acceptable to communities and patients. Equal treatment builds opportunities for health and care workers and the populations they serve. Providing support means protecting health workers' safety and health, providing workplace mental health and family support systems, fair and equal pay, which underscores investment in education, training, and jobs, and addressing challenges to keep health workers in their position. Safeguarding rights of health and care workers is both a moral and legal obligation of governments, employers, and managers. Retaining existing health workers and attracting new workers to health and care work requires upholding protection from retaliation, whistleblower protection. So, what can be done to ensure decent work? Protect the health and safety of workers, including their mental health and well-being, by giving it higher priority on the policy agenda and implementing the evidence-based strategies that we know exist. Invest in health sector jobs to encourage growth. The health and care sector is one of the largest employers globally. But creating jobs is not enough. Retention of the existing workforce is needed. Decent work increases health workforce investment efficiency. Invest in workplace environments and culture that prevent burnout, promote staff well-being, and support quality care. Together, use multi-sectoral stakeholder dialogue and engagement as a mechanism for change. Implement strategies for decent work, including use of the Global Health and Care Workers Compact at the national, sub-national, and facility level with governments, employers and managers, and workers' associations. It's time to be a champion for decent work. It's time to protect, invest together. For more information, please visit our website or write to us on workforce2030@who.int.